Escape Family Resource Center was created in 1983 by a small number of community leaders in response to the findings by Dr. Henry Kempe, a pediatrician, and the first in the medical community to identify and recognize child abuse. His paper, Battered Child Syndrome, revealed that children were hurt and severely traumatized at the hands of the very people, the parents, who were supposed to guide and protect them. Educating at-risk parents and the victims of domestic violence on how to parent in order to prevent child abuse and neglect before a child is hurt has been our mission since the beginning. Our fervent hope is to reach families whose severe economic challenges and social distress significantly diminish their capacity for creating safe and nourishing homes for their children before these children become statistics of state institutions. We have requests for our programs from all over the Houston area and beyond. We recognize the need to create selected online courses that reflect our unique methodology, nuanced approach to specific populations, and commitment to measure the quality of our work. There is also a big challenge facing us. We need a permanent home, and we need the community support to make it a reality. Escape is mission-driven. We exclusively develop and deliver child abuse prevention programs. We review the curricula annually to keep it relevant, reflecting best practices. Our specialty is brisk response to our clients' requests for additional programs with respect to changing demographics of our community. We've created programs addressing various parental challenges, such as raising children with disabilities, immigration, single parenthood, divorce, and high-conflict environments. We are a small organization. Our unique capacity for sharing resources with nearly 100 collaborators has allowed us to decrease costs and increase the number of clients served. Escape has a very dedicated board of directors and a highly competent and passionate team. Our strategies are informed by our mission. We developed a business model that allows us to expand or retract according to funding availability in order to effectively educate families in crisis in the prevention of child abuse and neglect. This is accomplished with the innovative approach to our organizational design. We have 14 full-time employees and nearly 60 part-time educators. With each program site, we engineer a team of educators to deliver a specific class. This allows us to keep our fixed costs lower and reach farther. Escape uses several evidence-based tools to evaluate the effectiveness of our programs. Our adolescent parenting inventory uses a quantitative methodology. It defines success as a positive change in parenting attitudes. The Parenting Stress Index focuses on intervention in high-stress areas and predicts children's future psychosocial adjustment. Client surveys allow parents and children to reflect on the skills they've acquired and are implementing upon completion of our programs. 81% of parents with children of all ages experience significant reductions in parental stress levels. 92% of parents fell into the area of low risk for mistreating their children upon completion of an escape class. Escape is well respected among social services providers, family courts, schools, neighborhood centers, and community agencies. Commonly unknown is the fact that Escape is the only organization in child abuse prevention field that employs the family systems approach, which means that all our programs include educational curricula for parents and children from 3 to 18 years of age. Classes are conducted simultaneously but separately to ensure privacy and are held in English and Spanish. Only master's degree educators deliver our parenting programs, and we measure each program for outcomes. Since 2000, we have grown 2,600% through collaborations, as well as developed and implemented new award-winning child abuse prevention programs. We've increased our number of programs by nearly 400% and reduced our full-time staff from 23 to 14 by implementing our new business model. Upon finishing an ESCAPE class, not only have the relationships at home improved, but our certificates of accomplishment have helped clients find new jobs. Parents tell us that there is no more swearing in the house. It's lighter, and there are healthy discussions. More importantly, the children tell us that their parents listen to them and don't hit them. When people think about child abuse prevention, it usually has to do with intervention after abuse has occurred. This is true of funders as well. Community resources are focused on after-the-fact treatment for victims of child abuse. ESCAPE's challenge has been to raise awareness about the pressing need and long-term benefit of preventing child abuse before it happens. Our measures clearly show ESCAPE's child abuse prevention programs are an effective agent of change for parents who are at risk of abusing their children. But changing public perception requires the kind of human and financial capital ESCAPE simply doesn't have. Our greatest need is the construction of a permanent home for our organization. ESCAPE is leasing work and classroom space in a Harris County office building in the Spring Branch area. It is challenging for our clients who come by bus from all over to reach us. The current space doesn't have enough classrooms to teach all age groups for our full family programs. Our goal is to build a cutting-edge facility emblematic of the importance of family harmony and the prevention of child abuse. The new ESCAPE would accommodate significant increases in programs and include state-of-the-art audiovisual technologies that would allow us to reach our clients remotely. We've historically prioritized and restricted funds to the expansion of programs, as opposed to investing in marketing and public relation efforts to educate the public and potential donors to the critical importance of child abuse prevention. Additional resources would enable ESCAPE to vastly strengthen our child abuse prevention outreach efforts, educating potential funders to the tangible benefits of making child abuse prevention a priority and guaranteeing our children a brighter day ahead without fear of violence and neglect.